patients had any of these autoimmune problems. So they very astutely said, what's the difference? And they realized that one of the differences was the use of this medication that's designed for malaria originally, but it's been used quite frequently for those ailments. So the hydroxychloroquine became the subject of a trial. They randomized 62 patients. So it's not a big trial, it's small, but it was enough to give them, they thought, a pretty good idea of whether there was any benefit or not. And when they randomized the patients, they all got the regular treatment they were offering in China. And then one group got nothing besides that. The other group got, for 5 days, this hydroxychloroquine. And what they realized was pretty interesting. First off, the symptoms, the temperature, the fevers. Instead of lasting 3 days in a typical illness, it only lasted 2 days. And the issue that many folks have, which is around coughing, which is the classic sign of it, fever and coughing, that also went from 3 days on average in the control group down to 2 days in the folks with medications. Doesn't seem like a lot, but those are both statistically significant. And there are other potential reasons why that might have happened that we have clues of from the French data. For example, maybe they were having less virus. Maybe it makes them less contagious. We don't know for sure, but these are interesting potential tools for us to use in the future. But here's the part that caught me. In China, they do CT scans of the chest. They look for pneumonia. All these patients had pneumonia. And over the course of the 5 days, in the people with the controls, the pneumonia was made better 55% of the time, but it was made better 81% of the time in the people taking the medication. That's a statistically significant benefit as well. And finally, one last bit, 4 patients had bad outcomes. All 4 were in the control group. None of the patients in the experimental group who got this medication had that. So putting it all together, the authors argued that it supports the decision by China to use this drug routinely.
Hydroxychloroquine, we know it's an anti-malarial drug. We know it's also used for lupus. We know it's also used for rheumatoid arthritis. We know it's also been around for 45 years. Now, in countries that have high incidence of malaria, are we seeing the kinds of COVID-19 breakouts, number one? Number two, how quickly could we look at the data of people that have been using hydroxychloroquine for rheumatoid arthritis or lupus, or maybe they were traveling as an anti-malarial drug, and determine whether they are less prone to get this? In other words, that would almost have prophylactic effects.
I don't know the answer to the first question because our data is not so good from those areas, but the answer to the second question is really interesting. Brian Kilby posed that question to this morning, and just like the Chinese researchers noticed just in their own hospital, we could do a massive search of the entire Medicare database or the Medicaid database. And I actually wrote an email to Seema Verma, who's very, very talented administrator for CMS, asking if she would do that. Don't identify the patients. Keep the patient name secret. Just compare people who purchased for their medical condition hydroxychloroquine and compare it to people who didn't purchase it because they don't have those conditions. Maybe there's a difference that we can identify between who gets COVID-19 that might be additional supportive information. Right now, physicians are desperately looking for tools they can use, especially early in the course of the illness. Is it possible that because these patients who are already on it don't get sick, we could use it prophylactically in doctors and nurses? We started that trial at New York Presbyterian. It's an interesting concept. But also think about the idea of being able to treat patients early after diagnosis and prevent worsening of the disease, thus keeping our ERs empty, etc. This is the possibility. We'll only prove it with a larger trial, but this is tantalizing bait.
I want to just say this, because for every doctor, every nurse, my mother wanted me to be a doctor. I messed up. I really did. My sisters were all nurses. But on the front lines every day, every medical professional, people like yourself, every doctor I know, every doctor in a hospital, they all deserve our praise tonight. And I know you're working 24/7 on this because I talk to you late into the night and you're not sleeping. Neither am I. I may have to talk to you about that. I might be some kind of off-label medicine for that one day. Thank you for all you do. We appreciate it, and for everybody in the medical field.